So we all know virtual reality is used a lot for games and entertainment, but now it is being used to help reduce pre-surgical anxiety. So joining us live to talk and show us, what it's all about, Dr. Jordana Sandy. She's a chief resident of the neurology residency program at Nuvance Health's Vassar Brothers Medical Center, and Dr. Paul Wright, senior vice president of the Nuvance Health Neuroscience Institute. Thank you both for joining us this morning. We're excited to have you. We do want to say Jordana, Dr. Sandy, is related to a KGO employee, our friend, colleague, and director, Jerry, who is directing right now. So this is very special. Thank you both for coming in. I do want to take some time to put it on. So you guys had me fit it on just really to get prepared. And what I'm going to be seeing now, I believe our viewers will also be seeing. And then Dr. Sandy, you had mentioned.
So one of the headsets should be lit up.
Yes.
So that one you're gonna just hold over your stomach. Usually our patients would be laying down.
Okay.
But this is basically to measure your breathing through this program. So when you breathe in, you kind of sit there and you look around. And when you breathe out, you actually are moved forward in the program. So it's really to help you work on your breathing and that meditation, relaxation to, really focus on the program.
Yeah, no kidding. And so we're talking about pre-surgical and anxieties, and I can absolutely already feel much calmer, and I'm not even getting ready for surgery right now. What had you all kind of entering this realm, including VR, in this?
We're really interested in using new technology in the neurology field. There's so many new uses that we can find for technology, but virtual reality is really an up and coming, thing that people are doing. Anyone can go out and buy a headset, but we want to bring that actually into the world of neurology, and thought that this would be a great thing to do, is to use it in patients who are feeling really anxious, or even healthcare workers who are really anxious, so that they can decrease their anxiety. And actually, we have found that decreased anxiety leads to lower inflammation, and it will actually improve outcomes, because we will be able to allow patients to be discharged from the hospital sooner if they feel less anxious. So that's just a couple things that this program can do.
That's incredible. And so applying this, have you all seen a lot of success with really reaching, less anxiety for a patient?
We have. We actually tested it on the residents, so my cohort of residents, and they actually told me that they felt more relaxed, they really enjoyed wearing it, and they felt more ready for work. So I actually put it on them right before their shift, so that was the time that we felt like it was going to be a more stressful time for them, and I got really positive feedback from that part of the study. And so we were able to take those results and move on to this part where we're testing it in actual brain tumor surgical patients.
That's incredible. And when it comes to what I'm looking at, what about this visual aid is really triggering that response of calmness?
So what happens is, when you're looking at this, you're starting to see a landscape, and you're immersed into a landscape where you're actually hearing music and you're actually being distracted. And the program's actually telling you to sort of be aware and be mindful of the environment that you're in, which is a different environment from the hospital. So it's taking all of this stress and actually starting you to be involved in your breathing and be distracted.
Mm-hmm. And distraction is a huge word for that, because I am just imagining, I had 2 C-sections. I know it's nothing comparative to, surgery that you all are doing, but this would have helped me getting that epidural put in, because that is nerve-wracking. Yeah. And so, this, for my second C-section, and I don't want to make this about me, but I was so nervous because I knew what to expect and the pain, that the first insertion didn't work, because they were like, you need to relax. And so are you seeing kind of that happen too, where people who maybe have been familiar with major surgeries are saying, okay, I need something to calm me down because I know what to expect this time around?
Absolutely. Well, when we started doing this, we started looking and seeing at what point do people have the highest amount of anxiety? And Dr. Sandy said, well, let's do this with our residents. Let's see, with neurology residents coming on with their first shift in the morning, that's when they don't know what the day is going to bring them. So that's the area where they have the heightened anxiety levels. So let's take a little bit of time out, be mindful. But then we started seeing, because of the success of this program, that we said, well, where else can we do this? And Dr. Sandy was saying, well, you know, when someone's going for brain tumor surgery, we can all imagine that's probably one of the scariest things that anybody could go through. And not only that, usually you're surrounded by family members, and many times this is the first experience that someone's had in a hospital, and as the first experience, it's the most scariest. So everyone's looking at the patient, they don't know what to expect, they're moved down a hallway into a strange environment. So this way, they're actually doing something different. They're breaking that traditional cycle.
Yeah, so doing something different. What comes next for you all with all of this advancements in technology and these practices?
Yeah, so when we finish enrolling in this study, we're currently recruiting about 20 patients, so it's a pretty small study. But after this, we want to actually test blood work, we want to test vital signs, we want to look at those actual inflammatory markers and measure how much of a decrease that these patients will have before and after they use the headset, so we can use other measures. But right now we're using basically surveys that these patients fill out before and after the headset to measure how they feel their anxiety is doing after they use the headset. So we want to couple that with the objective measures that we plan to do.
Yeah, okay, well, I'm gonna stop. This is definitely making me feel calm. I'm like, oh my goodness, I could stay here all day. Thank you both, Dr. Sandy and Dr. Wright, for joining us and sharing all the important work that you all are doing. We definitely have enjoyed you. We absolutely enjoyed Jerry, so thank him for sharing you with us this morning. And we look forward to what you guys do next.
Thank you so much.
Yes, absolutely.
Thank you so much for having us.